The Minister of Health and Social Welfare says the federal government will prioritize investments in health and infrastructures in tertiary hospitals to ensure Nigerians have better quality health care. Pate said this at the 2023 annual general meeting of the Committee of Chief Medical Directors and Medical Directors of Federal Tertiary Hospitals in Nigeria in Abuja.
The federal tertiary hospitals are the bulwark for Nigeria's health system, because all the failings of the lower level ends up on your table. The dialysis, the advanced cancer care, the complicated surgeries, the complicated infections could have been prevented if there was sound primary healthcare system. When I went to Kano, I saw malaria being treated in a teaching hospital. That's 10 times more expensive. You don't have to be a consultant to treat simple walk-in pneumonia. But many of you are burdened by that because they're failing at different levels, and you have been the last standing, I would say. So you're very important. You're the cornerstone of the vamping Nigeria's health system, and we need to focus on that as a second pillar of our agenda. Not only the public facilities but also engaging with the private sector. And many of you have already ventured on the path of public-private partnerships. We saw some very good examples. How do we take them to scale, given the fiscal realities that we are facing? This year, for the first time in a very long time, the health sector is getting at least almost 5% of the budget. So there is a deliberate effort to increase domestic financing on the part of the government. Anywhere near the 15% of which a commitment. But it signals the intent on the part of the president to ensure that the health of Nigerians is improved. Because I think for a very long time this has been talked, and now we have a president who really wants to act, and he's acted, as you see in the budget, which you all and we will defend.
Earlier, the chairman of the committee, Professor Bassi, said the tertiary hospitals were faced with so many challenges ranging from finance, inadequate budgetary allocation to overhead, and high cost of equipment, among others.
They also have the challenge of inadequate infrastructure, equipment, and technologies. We are all expected to be digitalized, but the cost of digitalization is extremely expensive. And the failures in the primary and secondary health sectors, which have resulted in an overburdening of our tertiary hospitals. We are providing primary, secondary, and tertiary all at the same time. We also have the challenges of undue political interference, especially in the appointment of CMDs and MDs. Recruitment, you want to recruit, the challenges you have. And of course, allocation of resources. But despite all these challenges, sir, our hospitals have been resilient and are replete with remarkable feats of medical excellence and best practices. Everywhere we have the documentary evidence of things we have done, best practices and excellence in our hospitals. Indeed, sir, this generation of CMDs and MDs are fully committed to raising the bar of tertiary health care delivery in the country.
The guest speaker, Professor Abdulmumini Rafindadi, in his lecture, Sustaining Quality Tertiary Healthcare Delivery in a Challenging Economy, said delivery of quality healthcare in the public sector was essential for promoting health and well-being in communities.
The patients must be able to trust the healthcare professional with their lives and health. And in order to justify and that the trust the professional must show respect for human life and make sure that care given meets the expected standards in 4 domains. One is the knowledge, skills, and performance. Another one is the safety and quality. Another one is the communication, partnership, the teamwork. Another one is maintaining trust. And all of us must remember that we are personally accountable for our professional practice and must always be prepared to justify our decisions and actions. Staff welfare and well-being are very important in the delivery of healthcare system.
The Chief Medical Director, University of Abuja Teaching Hospital, Gwagwalada, said the meeting was a way of sharing challenges and sourcing for solutions to move the tertiary hospitals forward in healthcare delivery.
As a body of CEOs, as a committee, We meet quarterly as a form of peer review mechanisms. We share challenges and sought for solutions. We also take the opportunity to make advocacy visits to relevant agencies and organizations that will assist us in our primary assignment, which is the healthcare delivery at the tertiary health system. This particular one, we're lucky that the Honorable Minister for Health in person attended our opening ceremony, and from the conversation we know we have a lot of good things in stock for us as we enter the new year 2024.